The research is clear. When you stop your GLP-1 medication, you will regain your weight. So what dose do you actually need in order to maintain that weight loss? So the SURMOUNT-4 trials, they dropped some sobering data here. When patients stopped tirzepatide, after 36 weeks, there was an 11-point difference in quality of life scores between those who stayed on the medication versus those who stopped. We're talking about energy crashes, mobility issues, emotional struggles, not just numbers on the scale. The STEP trials are even more alarming. The research shows significant weight regain. Most patients regained the majority of their lost weight within a single year. But here's what they don't emphasize. This is important. Pay attention to this. Most of that regain happens in the first 3 to 6 months. It's rapid, it's demoralizing, and it feels inevitable. The standard medical approach says this means you need to stay on the medication for the rest of your life. It's a chronic, irreversible disease, they say. Maximum doses, that's 6,000 a year, indefinitely. And look, I get why doctors say this. They're looking at the data and they don't understand metabolic health. It's not really taught in medical schools. They regain weight. That's what patients do, case closed. But that's wrong because these studies have a fatal flaw. They only look at people who used GLP-1s like a Band-Aid, not a tool for transformation, not a catalyst for lifestyle change. The participants lost weight, sure, but they never addressed why they gained it to begin with, aka insulin resistance. So think of it like this. If you have a broken pipe flooding your basement, you can keep mopping up the water over and over and over, but if you don't fix the pipe, you're gonna have a problem. GLP-1s are incredibly effective mops, but if you never fix the pipe, of course the basement floods over and over again when you stop mopping. The pipe in this example, that's insulin resistance. And in our practice, we see about 8 out of 10 patients who stop their medications without really fixing insulin resistance, they end up regaining their weight, almost most or all of it, matching exactly what the studies show. And the other 2 out of 10, let's call it dumb luck. But if you want better odds in this game, keep it locked in this video because I'm gonna break all this down so that you can get better odds. By the way, if you're realizing that your weight just keeps coming back despite perfect dieting, hit that subscribe button right now. We put out 2 videos every single week revealing metabolic breakthroughs in GLP-1 medications, just like what I'm about to show you with Adam's insulin transformation. Hit that subscribe button now because it also helps out the channel as well.